A breast reduction is a procedure that is done to reduce the size of the breast as well as improve the overall shape and contour. Breast reduction surgery can be very empowering. For many women, this is a very emotional journey. Through surgery, life can be greatly enhanced. Patients are able to do activities they couldn't do before, wear clothes they couldn't wear before, and sometimes improve neck and back pain, which was debilitating. There are several ways a breast reduction can be performed. It depends on the type of incision used on the outside and the way the breast tissue is rearranged on the inside. The incisions used, which are essentially the scars you will see, will either be a lollipop or the more traditional anchor design. Although the incision seems to be most important to patients, what is done inside is equally important. Most surgeons trained in the US are trained utilizing an inferior pedicle technique. I find this technique to be flawed because it is one of the main reasons why people bottom out or sag with time. Instead, I prefer what's called a superior medial pedicle technique. This technique leads to a more predictable and lasting result in my hands. So here are a few key points to consider when it comes to your breast reduction. Symmetry. You want to make sure that when everything is done, your breasts are symmetrical. Many patients start out with one breast larger than the other, but the goal at the end is for them to match. This is accomplished by your surgeon sitting you up and down several times during your surgery and weighing the tissue being removed from each side. Over-reduction. You want to make sure that your breasts are not over-reduced. I often see patients coming to me for breast augmentation after having a reduction, and this is a preventable problem. This usually happens when a patient has a wide breast and wants them to be significantly smaller. It is not only about size of your breast, but also how they look. A wide breast that is small will be flat. A narrow breast that is small will be round. It is your surgeon's responsibility to guide you as to the correct amount of reduction that will still leave you with a beautiful breast. Now, bottoming out. You want to make sure your breasts don't bottom out over time. Many years later, patients will complain that their breasts are sagging more than they did before they had their reduction. This is mostly due to using an inferior pedicle technique for your reduction. Now, length of incisions. You want to make sure your incisions are short and they don't extend into the armpit and into your cleavage. This is a very difficult problem to correct, and you'll never be able to make those scars go away. Your surgeon must take his time when marking you before surgery. If this is done poorly, he may attempt to correct this during surgery, and this is what often leads to longer scars. And finally, as always, closure is everything. The way your incisions are closed determines the final result. The number one fear and complication with breast reduction is poor scars. This defeats the entire purpose of the breast reduction. You want to look good in and out of your clothes. Make sure your surgeon and not his tech is closing your incisions and that he takes his time. What doesn't get done during surgery cannot be corrected with creams or lasers later. So now let's talk about recovery. The recovery time for breast reduction is actually quite simple. Pain is minimal as the muscle is not involved during the breast reduction. After 1 week, your doctor will remove your bandages and stitches. Then, after 4 to 6 weeks, you'll go back to all the normal activities and exercises. Except this time, you'll be able to wear clothes you never could before, and most patients find activity levels increase dramatically and pain is significantly less. So I strongly believe that if you do your homework and identify the right procedure and the right surgeon, a correctly performed breast reduction can greatly improve the quality of your life.